Hello, Markus. It's my great pleasure to introduce today Dr. Markus Schmidt, who is the Medical Director of Sleep Disorders Center at the Interspital at the Bern University Hospital. And today we will talk about your recent paper about the feasibility of the long-term monitoring with the Fitbit smartwatches in central disorders of hypersomnolence, which is based on the Sphinx study, the Swiss primary hypersomnolence and narcolepsy cohort study. Thank you, Markus, for finding time to make this interview with us. And please, could you tell us what are the key take-home messages of your research?
Well, first of all, thank you for the invitation. It's a pleasure to be here today. So, we were interested from the Sphinx study. The Sphinx is a big study right now looking at new biomarkers for diagnosing central disorders of hypersomnolence. Right now for narcolepsy, we only have the hypocretin, in the absence of hypocretin or orexin, as really a clear biomarker for the disease. We have some others like short REM latency, but we can see that also in other disorders. And so we're looking for new biomarkers. And so now we're in the age of all these new devices that we have, the smartwatches, the nearables and wearable devices that we have. And so we were interested to see if there are digital biomarkers that we can identify for separating these different disorders, narcolepsy, idiopathic hypersomnia, and so forth. And even just, chronic sleep deprivation. And so that was the real impetus of doing this study, is to see what we can identify. And the Fitbit is one device of many that we could have used, but because of its lower cost and being able to go about a week or more without having to recharge, that was one of the reasons we went for compliance, to see if we can use the device. And what we wanted to do was two things from the study: was how our compliance with these devices in patients, not just healthy people at home. And the second was to look for those biomarkers. And so that was the real aim of the study, basically.
Okay, thank you. And what are the main findings? What kind of biomarkers were really distinct in patients with narcolepsy disorder from the health controls?
So two things. One is from just a compliance with all the patients, for example. What we found is that the patients were the compliance was high. We did it even for a 1-year recording, which is very nice. In terms of the biomarkers, here we really focused on just comparing the narcolepsy type 1 versus the healthy controls, because those are the two groups that are really clearly distinguished that we already know. And we wanted to see if the smartwatch could differentiate the two, and to build a pipeline basically that we could use for applying these techniques to the other groups. And so what we found is it's not just one marker. All right. For example, the Fitbit records activity, it records the heart rate, and using its algorithm, it actually can score sleep staging. And so these sleep parameters, so activity, the heart rate, and sleep, were the different domains that we used. And what we found is that on many of these different parameters, we could see some very nice differences between the NT1 group and the healthy control. One is just activity. So healthy controls are more active in the daytime. We see that in terms of the minutes of their activity and the number of steps that they do. But then from heart rate, we also see that the narcolepsy patients have a lower heart rate, maximum heart rate than the healthy controls. And it's important to remember that hypocretin is not just for waking, right? It also plays a role in the sympathetic nervous system, so keeping our heart rate up. And then for the sleep parameters, we see that the narcoleptic patients have a higher wake after sleep onset. They have more awakenings at night. They have a shorter sleep latency. They actually even have a shorter REM latency. We see some short SOREMs even that it was able to pick up. So here we have this multimodal approach, and we see a profile actually, that is from all these parameters that is very different, like a fingerprint, if you will, taking all these different aspects. And we see a nice difference, clear differences between the two groups on basically the whole parameter profile.
Wow. Does it mean that in future, people who wear the smart watches in their daily life could upload their data from the smartwatch and really get the idea that they have this disorder or not? What is the implication for the patients? What difference does it make for the patients, maybe in future?
This is a good question. There are aspects of course, this is a dream, right? We would love to be able to say, hey, just download your data and let's see what you got. What's your disorder? And maybe someday that may be possible, depending on the types of parameters that you are collecting. Very difficult to say at this point, because here we just compared NT1 and healthy controls. When we add in all the other narcolepsy borderland patients, these idiopathic hypersomnia and narcolepsy type 2, we see that there's a huge range of data that overlaps what we found in the narcolepsy and the NT1. And we think that there are other subgroups in there. And so we don't know yet. That's the idea, is we're going to at the end combine these data with the microbiome data, the proteomics data, and all the other things that we have, so that we can see maybe there are digital biomarkers for these other subgroups. But right now we don't know that. But that would be nice to know. The other thing that would be nice to know, by the way, is managing a patient, right? So if a patient has narcolepsy and you give them medication, do we see changes in their digital biomarker profile that suggest that they're doing better or worse? And this is something that we don't know yet, because we really took a limited number of patients. The N is a little small, basically to make to know. We had 75% of the patients, for example, that were on medication in the narcolepsy group, and about 25% without. And so we don't know yet, but this is definitely on our radar, and we'd like to know this.
Okay. As I have understood, in your group, you had patients who were treated with a specific treatment for narcolepsy, and they also demonstrated the same patterns, the same changes as untreated subjects. So at this moment, the group looked homogeneous, let's say.
Well, because it could be that if we start to have a bigger N, that we may see some differences in activity and so forth in these groups during the day, which we didn't pick up because we just didn't have the power to really separate it out. But I suspect that there are some things in the data there that we would see as a difference. And one of the things to keep in mind, one of the limitations with the Fitbit is that we can't distinguish naps very well during the day. And so just napping or not napping would be difficult to differentiate. And that's a limitation, because we'd like to see that kind of data to know if they're staying awake better, for example, and really maintaining wakefulness better in the daytime with management, for example. So I think that these are questions we still don't know.
One more specific question. Have you used the subjective data from these patients? I mean, like sleep diaries that they were keeping during the smartwatch wearing time, or you haven't used it in this analysis?
So say that question again.
Have you used and analyzed the subjective data based on sleep diaries, if the patients kept them during this smartwatch time?
So we do have a whole data set of subjective data that is another element that we're collecting as part of the Sphinx study. And we have not yet combined them, because remember, some of those points in time, we take subjective data only intermittently. Like when they come for the office visit, we get their Epworth Sleepiness Scale and so forth. And these data we're collecting over a year, and we took for this study the 2 best weeks of their compliance, so we could really download that. But what we want to do moving forward is taking their entire year data, all right, and look for many other things like seasonal changes and so forth, and also looking at how it may correlate with their subjective ratings that were only done intermittently during the year.
Oh, that would be tremendous work. But really, we will be looking forward for these results. And one more question. What was the most unexpected or surprising result, the finding of your research for you?
So that's an interesting question. So we had we were talking about how can we get and analyze data because using these heart rate and so forth, and just from a theoretical perspective, one of the thoughts that came to my mind is, well, given that the hypocretin system plays a role in the sympathetic nervous system, helping drive, with activity, driving heart rate, we thought, well, maybe it would be nice to see if the narcolepsy patients, for any given level of activity, just have a lower heart rate. So if you can, keep the activity constant, looking at between the two groups, are narcoleptics just having lower heart rate at any of those activities? And that we actually could find in the study, and it's one of the first times I've seen that analysis of taking heart rate at high activity levels that are similar between the two groups, and seeing that narcoleptics just don't generate the same heart rate level. And that was surprising because it was very robust as a difference between the two groups. And I was expecting to see just maybe more variability, but no, actually, as a group there, you see in the healthy controls, it's very tight. Any given level of activity has a specific level of heart rate, and this was quite reduced in the narcolepsy group. So that was an unexpected, but it tells us that there may be aspects of the data that are actually hidden there that we just have to be thinking about, even in a disease-specific manner, that maybe we can harness these data and really help us identify these new digital biomarkers. This is really an open field, and I think that there's much there that we need to learn, basically.
Yeah, that's true. And it's also a window to the cardiovascular involvement in these patients also. It looks like that. So I think when you get the 1 year data, you will really have a groundbreaking results, and we are looking forward to read more of your research in this field. Thank you very much, Markus, for sharing with us your results and your research. Thank you very much.
Well, thank you for having me. It's a pleasure.